We are back now with an important today's checklist, helping you navigate the healthcare system.
Yeah, from assessing your records to knowing the right questions to ask, we know how confusing and how overwhelming a doctor's office can be.
So here with a bit of a crash course, Dr. Jennifer Haythe, cardiologist at NewYork Presbyterian Hospital, Columbia University. Dr. Haythe, welcome back.
Thank you so much.
Everyone's guilty from time to time of putting off those appointments, but I think some people can get overwhelmed as well. Where do you even start?
Well, I think the first thing to do is try to organize your healthcare a little bit, because you really are a consumer of your own healthcare and you need to be proactive. So first of all, if you're taking medications, make a list. Either take pictures with your phone. I can't tell you how many people come to my office and they don't know the medicines they're taking or the names or the doses. So make a list, take a picture, put it in a Google app, whatever you need to do. Next, I want you to make a list of your healthcare screening. So last time you had a colonoscopy, pap smear, mammogram, bone density, everyone has a phone. Just write it down. I had it on March 5th of 2021.
Oh, like in your notes section?
Yeah, just in your notes section, keep it. Same with vaccines. So, if you have a flu shot every year, you can just say, I get my flu shot every year. But things like the shingles vaccine, which happens when you're over 50, and by the way, now linked to less dementia, so one to get, is, something that you won't need to get more than once probably. Or, your Pneumovax. So that's really for people over 50 as well. So your doctor will want to know if you've gotten those vaccines, and you should have a record. And finally, everybody, for the most part, has an electronic medical record now. If you don't understand, or you're a little bit older, have your younger child or nephew or friend help you set it up on your phone. It's really a wealth of information of all of your health care. Yeah.
Doctor, you hear so much about people going to emergency rooms or urgent care instead of having a primary care physician, particularly young people. They think they're invincible. They think they don't need to. It may seem obvious, but explain why that is not a good idea and how one should go about finding a primary care physician.
Right. Well, look, the ERs, they have amazing care, and, people work really hard there, but it's really meant for emergencies. And you're right. A lot of people use it. They check in. It's fine. If you're really sick and you need to go to the emergency room, go. Or a telehealth visit. But the best thing you can do is get a good primary care doctor. Your primary care doctor will be the captain of your ship. They will direct everything, tell you, what you need, when, and when you're sick, you can go see them. Right. So you want to pick a person that's kind of close. Don't pick someone really far away so you're driving an hour and a half to see your primary care doctor. The other thing is pick a really good network system. So for instance, I'm part of NewYork Presbyterian Hospital system. In California, there's Kaiser or UCLA, and Michigan, it's Trinity, and Florida, Advent. Pick a system, because those systems, they take the same insurance. The doctors will be able to talk to each other. They're all able to communicate and stay on track. The other thing is, you want to pick one pharmacy, ideally. With electronic pharmacies now, if you're somewhere and your doctor sends a prescription for you when you're on vacation and that's still in your record, sometimes your prescriptions will get sent to the wrong pharmacy. So make it simple. Have one pharmacy, tell your doctor to delete all the other ones.
Okay. We know how important it is to be our own advocate, but how can we make sure we're going in armed with all the right information to get the best out of that doctor's visit?
Yeah, so you are your best advocate. So first off, make a list of questions. You have the right to that time with the physician. Ask them what you want to know. Make sure you really understand your diagnosis. So if you're told you have a condition or a disease and you don't know what that means, have them really explain it to you. Maybe draw a picture or a graph. Some are pretty complicated. The other thing is do your own research. It's really important that you take some ownership. So maybe you need a transplant, or you have a complicated disease that needs a big surgery. Look around, see who does these surgeries. It's okay to get a second opinion. Your doctor shouldn't be offended. And if they are, then you should find a new doctor.
Okay.
Yeah, great tips there.
Yeah.
Really quickly here before I let you go, according to government data, the average American spends about $14,000 a year on health care. Anything people can do to bring those costs down?
So the best thing you can do is be healthy, because then you don't need a lot of medical care.
Fair point.
Yeah. So I always tell people, first of all, you want to, take care of all your risk factors, take your medications, but also, if some employees will actually give benefits to people. So they'll give you a gym membership. And if you take that, some of your expenses will be less, or they'll give you rebates if you quit smoking. And, they have incentive programs. So really try to do that. Use generic medications. Always try to stay in network. Those are some tips that can help you keep your costs down.
Prevention saves money.
Totally.
All right. Dr. Haythe, thank you. Thank you very much.
Thanks for having me.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.